Question 1. A nurse is caring for a client with chronic constipation. Which dietary recommendation is most appropriate for this client? A. Increase intake of high-fat foods. B. Decrease fluid intake. C. Increase fiber intake. D. Increase consumption of dairy products. Answer: C. Increase fiber intake. Rationale: increasing fiber intake helps to add bulk to the stool, which can stimulate bowel movements and alleviate constipation. High-fat foods, decreased fluid intake, and high dairy consumption can exacerbate constipation. Question 2. Which medication classification is commonly prescribed for patients experiencing constipation? A. Antibiotics. B. Laxatives. C. Antihypertensives. D. Anticoagulants. Answer: B. Laxatives. Rationale: laxatives are the primary medication class used to treat constipation. They work in various ways, such as softening stool, increasing bowel movements, or lubricating the intestinal tract. Antibiotics, antihypertensives, and anticoagulants are not typically used to treat constipation. Question 3. A nurse is educating a client on lifestyle modifications to prevent constipation. Which suggestion should be included? A. Limit physical activity. B. Increase intake of fluids, especially water. C. Follow a low-fiber diet. D. Increase intake of processed foods. Answer: B. Increase intake of fluids, especially water. Rationale: increasing fluid intake, especially water, can help prevent constipation by softening the stool and facilitating easier bowel movements. Physical activity should be encouraged, not limited, and a high-fiber diet is recommended over a low-fiber diet. Processed foods are often low in fiber and can contribute to constipation. Question 4. A client reports difficulty in passing stools for the past week. Which assessment finding would the nurse prioritize? A. Abdominal bloating. B. Heart rate of 78 beats per minute. C. Blood pressure of 120/80 millimeters of mercury. D. Urine output of 450 milliliters in 24 hours. Answer: A. Abdominal bloating. Rationale: abdominal bloating can indicate constipation, reflecting a buildup of stool. Heart rate and blood pressure are within normal limits and are not directly related to constipation. While adequate urine output is important for overall health, it is not as directly related to constipation as abdominal bloating. Question 5. For a client with constipation, the nurse suggests the use of a bulk-forming laxative. Which explanation best supports this suggestion? A. It stimulates the bowel by increasing the water content of the stool. B. It increases the bulk of the stool to stimulate peristalsis. C. It lubricates the intestinal tract to ease the passage of stool. D. It directly stimulates the nerve endings in the bowel to increase motility. Answer: B. It increases the bulk of the stool to stimulate peristalsis. Rationale: bulk-forming laxatives work by absorbing water in the intestine to form a soft, bulky stool, which then stimulates peristalsis and facilitates the passage of stool. Options A, C, and D describe mechanisms of other types of laxatives like osmotic, lubricant, and stimulant laxatives, respectively. Question 6. A client complains of constipation. Which over-the-counter supplement may the nurse suggest to aid in bowel regulation? A. Iron supplements. B. Calcium supplements. C. Fiber supplements. D. Vitamin D supplements. Answer: C. Fiber supplements. Rationale: fiber supplements can help regulate bowel movements by adding bulk to the stool and facilitating its passage through the colon. Iron and calcium supplements can actually cause or worsen constipation for some individuals. Vitamin D supplements are not directly related to bowel regulation. Question 7. During a health history interview, a client reveals the use of a stimulant laxative daily for several months. What is the nurse's best response? A. That's a good strategy to manage constipation long term. B. It's important to only use saline laxatives for chronic constipation. C. Long-term use of stimulant laxatives can lead to dependency. D. You should increase the dosage if constipation continues. Answer: C. Long-term use of stimulant laxatives can lead to dependency. Rationale: chronic use of stimulant laxatives can cause the bowel to become dependent on them for stimulation, potentially leading to further constipation issues when the laxatives are discontinued. Increasing the dosage without medical advice or switching to saline laxatives as a long-term solution is not recommended. Question 8. A client with constipation is prescribed an osmotic laxative. The nurse knows that the primary action of this medication is to A. Stimulate bowel movements by irritating the bowel lining. B. Lubricate the stool to ease passage. C. Draw water into the bowel to soften the stool. D. Decrease water absorption in the bowel. Answer: C. Draw water into the bowel to soften the stool. Rationale: osmotic laxatives work by drawing water into the bowel from surrounding tissues, softening the stool and making it easier to pass. This mechanism is different from stimulant laxatives, which irritate the bowel lining, and lubricant laxatives, which ease stool passage by lubrication. Question 9. Which of the following should the nurse include in the teaching plan for a client experiencing constipation? A. Try to withhold bowel movements until you have a strong urge. B. Limit fluids to decrease the likelihood of stool becoming too soft. C. Engage in regular physical activity to stimulate bowel movements. D. Use enemas regularly to ensure bowel movement. Answer: C. Engage in regular physical activity to stimulate bowel movements. Rationale: regular physical activity can help stimulate bowel movements and prevent constipation. Withholding bowel movements and limiting fluids can exacerbate constipation. Regular use of enemas is not recommended for managing constipation due to the risk of dependency and potential harm to the bowel lining. Question 10. A client with a history of constipation reports using senna, a stimulant laxative, frequently. The nurse should monitor the client for which of the following? A. Hypokalemia. B. Hypercalcemia. C. Hyponatremia. D. Hyperglycemia. Answer: A. Hypokalemia. Rationale: chronic use of stimulant laxatives like senna can lead to electrolyte imbalances, particularly hypokalemia, low potassium levels, due to increased bowel movements and potential for excessive loss of potassium in the stool. Hypercalcemia, hyponatremia, and hyperglycemia are not directly related to the use of senna. Question 11. A nurse is providing discharge instructions to a client who has been experiencing constipation. Which instruction is most appropriate to include to promote regular bowel movements? A. Limit your intake of fruits and vegetables. B. Decrease your daily fluid intake. C. Maintain a regular schedule for bowel movements. D. Increase your use of over-the-counter antacids. Answer: C. Maintain a regular schedule for bowel movements. Rationale: maintaining a regular schedule for bowel movements can help establish a routine, allowing the body to adapt and potentially improving constipation. Limiting fruits and vegetables, decreasing fluid intake, and increasing the use of antacids can all contribute to constipation. Question 12. A client with constipation is advised to increase dietary fiber. The nurse knows that the client understands the teaching when they identify which of the following as a good source of fiber. A. White bread. B. Whole grains. C. Ice cream. D. Cheese. Answer: B. Whole grains. Rationale: whole grains are a high source of dietary fiber, which helps to increase the bulk of stool and stimulate bowel movements. White bread, ice cream, and cheese are low in fiber and can contribute to constipation. Question 13. When teaching a client about dietary modifications to prevent constipation, which of the following beverages should the nurse recommend the client limit? A. Water. B. Prune juice. C. Caffeinated beverages. D. Herbal teas. Answer: C. Caffeinated beverages. Rationale: caffeinated beverages can have a diuretic effect, potentially leading to dehydration, which can exacerbate constipation. Water and prune juice are recommended for preventing constipation, and herbal teas can be beneficial if they do not contain caffeine. Question 14. The nurse is assessing a client for constipation. Which symptom would the nurse expect to find? A. Loose, watery stools. B. Abdominal cramping and bloating. C. Frequent, urgent bowel movements. D. Bright red blood in the stool. Answer: B. Abdominal cramping and bloating. Rationale: abdominal cramping and bloating are common symptoms of constipation due to the accumulation of stool. Loose, watery stools and frequent, urgent bowel movements are more indicative of diarrhea. Bright red blood in the stool may indicate hemorrhoids or other conditions, but is not a primary symptom of constipation. Question 15. Question 15. For a client taking iron supplements and experiencing constipation, the nurse should recommend: A. Decreasing the dose of iron supplements. B. Taking the iron supplements with milk. C. Adding a stool softener to the medication regimen. D. Switching to a liquid form of iron. Answer: C. Adding a stool softener to the medication regimen. Rationale: iron supplements can cause constipation. Adding a stool softener can help alleviate this side effect without compromising the treatment of anemia. Decreasing the dose of iron supplements may not provide the necessary treatment for anemia. Taking them with milk can interfere with absorption, and switching to a liquid form may not alleviate constipation. Question 16. The nurse is planning care for a client with constipation. Which nursing intervention is most effective in promoting bowel movement? A. Administering a barium enema. B. Encouraging a low-residue diet. C. Promoting intake of high-fiber foods. D. Recommending bed rest. Answer: C. Promoting intake of high-fiber foods. Rationale: a high-fiber diet is effective in promoting bowel movements by increasing stool bulk and facilitating its passage through the colon. Barium enemas are diagnostic tools and not used for treating constipation. A low-residue diet and bed rest can actually exacerbate constipation. Question 17. A client with constipation reports abdominal pain and nausea. The nurse recognizes these symptoms as possible indicators of: A. A normal response to constipation. B. An impending bowel movement. C. Bowel obstruction. D. The need for immediate laxative use. Answer: C. Bowel obstruction. Rationale: while abdominal pain and nausea can be symptoms of constipation, they can also indicate more serious conditions like bowel obstruction, especially if constipation is severe and accompanied by vomiting or inability to pass gas or stool. Immediate medical evaluation is necessary. Question 18. When educating a client about the risks of chronic laxative use, the nurse should emphasize the potential for: A. Improved bowel function over time. B. Increased risk of colorectal cancer. C. Electrolyte imbalances and dehydration. D. Enhanced nutrient absorption. Answer: C. Electrolyte imbalances and dehydration. Rationale: chronic laxative use can lead to electrolyte imbalances and dehydration due to excessive fluid loss through increased bowel movements. It does not improve bowel function over time, increase the risk of colorectal cancer in a direct manner, or enhance nutrient absorption. Question 19. A client with frequent constipation asks the nurse about the benefits of probiotics. The nurse's response should include that probiotics A. Can decrease the natural flora in the gut. B. May help to improve gut motility and balance intestinal flora. C. Are effective in treating acute diarrhea but not constipation. D. Should only be used under the supervision of a gastroenterologist. Answer B. May help to improve gut motility and balance intestinal flora. Rationale. Probiotics can be beneficial for individuals with constipation by improving gut motility and balancing the intestinal flora. They do not decrease the natural flora in the gut but rather help to enhance it. While supervision by a healthcare provider is advisable, probiotics are generally considered safe for most people and can be effective for both constipation and certain types of diarrhea. Question 20. For an elderly client with constipation, the nurse includes which non-pharmacological intervention in the care plan? A. Limiting fluid intake to prevent urinary incontinence. B. Encouraging the use of enemas as a first-line treatment. C. Promoting regular physical activity and mobility. D. Recommending the intake of low-fiber foods to simplify digestion. Answer C. Promoting regular physical activity and mobility. Rationale. For elderly clients, promoting regular physical activity and mobility can help prevent constipation by enhancing gastrointestinal motility. Limiting fluid intake can exacerbate constipation, as can a diet low in fiber. Enemas should not be a first-line treatment for constipation due to the risk of dependence and potential harm to the intestinal lining. Question 21. A client with constipation is interested in complementary therapies. Which recommendation is appropriate for the nurse to make? A. Acupuncture to stimulate digestive function. B. Aromatherapy with lavender oil to relax the abdominal muscles. C. Application of ice packs to the abdomen to reduce swelling. D. High-intensity exercise to stimulate bowel movements. Answer A. Acupuncture to stimulate digestive function. Rationale. Acupuncture may be beneficial for some clients with constipation by potentially stimulating digestive function and relieving symptoms. Aromatherapy may provide relaxation but is not directly related to relieving constipation. Ice packs are not typically recommended for constipation, and high-intensity exercise may not be suitable for all clients, especially without gradual introduction and consideration of their overall health status. Question 22. Which assessment finding would the nurse prioritize for a client experiencing constipation and taking calcium supplements? A. Heart rate of 60 beats per minute. B. Abdominal distension and hardness. C. Blood pressure of 130/85 millimeters of mercury. D. Urine output of 500 milliliters in 24 hours. Answer B. Abdominal distension and hardness. Rationale. Abdominal distension and hardness can be indicative of severe constipation or bowel obstruction, particularly in a client taking calcium supplements, which can exacerbate constipation. While the other vital signs and urine output should be monitored, they are not as directly related to constipation as abdominal distension and hardness. Question 23. A nurse is creating a bowel regimen for a client with opioid-induced constipation. Which medication should the nurse anticipate to be prescribed? A. Stimulant laxative. B. Antidiarrheal. C. Opioid analgesic. D. Anticholinergic. Answer A. Stimulant laxative. Rationale. Opioid-induced constipation is a common side effect of opioid analgesics due to their effect on slowing gut motility. Stimulant laxatives are often prescribed to counteract this effect by stimulating bowel movements. Antidiarrheals, additional opioids, and anticholinergics would not be appropriate as they could worsen constipation. Question 24. A client with constipation is prescribed polyethylene glycol. The nurse understands that this medication acts as A. Stimulant laxative. B. Bulk-forming laxative. C. Osmotic laxative. D. Stool softener. Answer: C. Osmotic laxative. Rationale: polyethylene glycol is an osmotic laxative. It works by retaining water in the stool, which softens the stool and promotes bowel movements. It is not a stimulant, bulk-forming laxative, or stool softener. Question 25. The nurse is teaching a client about preventing constipation. Which statement by the client indicates a need for further teaching? A. I will increase my water intake to at least 8 glasses a day. B. I plan to include more bran and whole grains in my diet. C. I will try to exercise for at least 30 minutes every day. D. I should avoid fruits and vegetables as they can cause gas. Answer: D. I should avoid fruits and vegetables as they can cause gas. Rationale: this statement indicates a misconception. Fruits and vegetables are high in fiber and should be included in the diet to help prevent constipation. While they can cause gas in some individuals, their benefits in preventing constipation generally outweigh this concern. The other statements indicate appropriate understanding of constipation prevention. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.